Respected viewer, welcome from Health Channel. Today I want to explain in briefly vertigo. This is our ear, middle ear and internal ear. Internal ear, the semicircular canal, vestibular nerve, cochlear and secure. This vertigo. Auditory pathway from the internal ear, the vestibular cochlear nerve. It go to the superior auditory nucleus, cochlear nucleus, inferior nucleus, medial geniculate body, and ultimately the primary auditory cortex, the thalamus. Our balance system of the body is a part of inner ear. It sends the information, head motion, orientation of the brain processing in order to send right command to rest of the body. With stability, coordination of the eye head movement, gait stability and orientation. So vertigo is a condition where the person has a sensation of moving of surrounding object moving when they are not. Often it feels like a spinning or swaying movement, and this may be associated with nausea, vomiting, sweating, or difficult walking. It typically occurs when head is moved. Millions of head injury, internal bleeding of the brain, and fractured bone, miserable burden life above the 40 years due to vertigo. Different cause of vertigo, especially inner ear, semicircular canal, vestibular neuritis. This is the cause. Vertigo, the feeling of spinning, loss of balance, dizziness, lightheadedness, loss of vomiting, feeling of floating, feeling of floor tilting. Peripheral vertigo, benign paroxysmal positional vertigo, considered most common form of peripheral vertigo, labyrinthitis, cause the dizziness, and you are moving. Vestibular neuritis and Meniere's disease. Central vertigo is a problem in the brain, typically brain stem or cerebellum, common cause of central vertigo, blood vessels disease with drug, aspirin, alcohol, anticonvulsant, multiple sclerosis, seizure, stroke, brain tumor, vestibular migraine. The transient ischemic attack, benign positional paroxysmal positional vertigo does not cause the further illness, and paroxysmal temporary sudden onset and positional related to change of body position. Vertigo, false sensation of spinning. Head injury, vestibular neuritis, Meniere's streptomycin injection, congenital gentamicin, tobramycin, and idiopathic. And brain tumor, hemorrhagic stroke, ischemic stroke, benign paroxysmal positional vertigo, Epley maneuver, benign paroxysmal positional vertigo, one of treatment. We find out the cause. History taking, physical examination, neurological examination, neuroautologic examination, and investigation, ENG, EEG, EMG, CT scan, MRI, MRA, and some laboratory investigation. The blood, complete blood count, thyroid hormone function, thyroid stimulator hormone T3, T4 to rule out hypothyroidism, and to diabetes to rule out anti-nuclear antibody autoimmune disorder, proteinuria, hematuria indicate the autorenal syndrome, CBC to rule out anemia, leukemia, electrolyte to see the balance, fluorescent troponin antibody to rule out neurosyphilis Lyme disease and allergic condition to rule out, and EKG, Holter monitoring EKG when evaluating dizziness patient who complain near syncope is very important to look out slow rate or prolonged QT interval, QRS complex slurred upstroke, PR interval, and calorie test, electrosystemography, optokinetic test, and CT MRI. The symptoms sudden onset have a asymptomatic period, dizziness triggered by head movement, Benign positional paroxysmal vertigo, erect to supine 45 degree during attack, rolling spin, and symptoms dissipate within 20 to 30 seconds. Audiometry calorie test induced nystagmus by thermal stimulation vestibular system by thermal calorie test spin head tilt 30 degree irrigate with water 40 seconds alternate with water 30 and 44 degrees Celsius. Vertigo full history and examination. If medical investigation diagnosis specific diagnosis need 73% the peripheral, central 15%, 9.7 unknown. Factor triggering is the position change of the body, standing up, walking, and dark loud noise, cough, nose, bloating, sneezing, straining, underwater driving, elevator, aeroplane, exercise, shopping mall, white open space, grocery store, food, salt, monosodium glutamate, fasting, alcohol, menstrual period, car travel, anxiety or stress. If any red flag sign, brainstem stroke or other central cause neurological symptom, sign, acute deafness, new type of onset, headache, vertical, the stigmas, urgent referral to for consultation. According to cause, the treatment. Usually, normal associated nausea, vomiting, antiemesis, meclizine, diphenhydrinate, diazepam, and some maneuver by physiotherapist or doctor, yoga, um, these some technique, vertical half somersault maneuver, same like Muslim prayer position. Reduce stress reduction, eat nutritious food, exercise, enough sleep, socialization, reduce internet, screen fatigue, and relaxation, stress, reduce and meditation. And avoid the high concentrated salty food and balanced food for vertigo, home remedies for vertigo. Thank you for listening. Thank you.